Many years ago, my mother died of cancer of the thyroid, and one of the things that were the most frustrating was that doctors would say, okay, I recommend this, I recommend chemo, I recommend radiation, surgery, but we were never told what are the chances that these things would work. What are the chances of being here, let's say 10 years from now, in terms of cure from that situation by the treatment? How much would surgery contribute to the cure? How much would chemotherapy contribute to the cure? And this was extremely frustrating because we were confused as to what to do and why to do it. So we were not informed in that way. Today, that still exists. One of the most common cancers is breast cancer. It's the most common cancer in females. And that's why I want to address that at this point, because there is a very important tool that unfortunately has not been used as much. It's called Predict. And the Predict website is very similar to the website that used to be called Adjuvant Online. Adjuvant Online I used in the late 90s. And it was an American website where you could put the different features of somebody with breast cancer, early stage. By the way, early stage, which means stage 1, 2, and 3, is very common in the United States. There are more than 300,000 cases of stage 1, 2, 3, which is early stage breast cancer, and is highly curable. But patients deserve to know exactly what is the contribution from each therapy to the cure. What are the chances of being here 10 years from now? And Adjuvant Online was an incredible tool. For some reason, it was removed from existence. Right now, if you go to the website of Adjuvant Online, it says that it's under construction. And it was highly criticized by oncologists back then in the 90s and early 2000s, because they would say, well, we need to be the ones in charge of telling the patients what the therapies are and what the success rates are. And I agree partly with that. What I do not agree is that today, there's no tool available in the United States for our patients. They need this tool. And the reason why we're doing this initiative at present is because we want to offer that tool to our patients. We've been using this tool, either Adjuvant Online or Predict, which is a site from Great Britain. Great Britain has the National Health Service. What that means is that everybody in Great Britain is under this healthcare initiative where everybody has healthcare included with the taxes they pay in Great Britain. And they include all the patients in the statistics because they're part of the National Health Service. And they developed this website where it does very similar things to what the Adjuvant Online website did. And it was also highly criticized when it came out. When it came out, there were about 3,000 patients that they used it with. And it was highly criticized by oncologists, saying this is not accurate, this is going to confuse the patients, they're not going to realize what the real cures are from whatever treatment we give. Unfortunately, it is not part of the discussion. I live in Puerto Rico, and in Puerto Rico in the United States, I don't know of any physician or oncologist that says to the patients, and this is what I recommend doing with our patients. Listen, you have breast cancer, stage 1, 2, or 3, which is the majority, is about 80 or more % of the breast cancer we find. And because of these different features from the biopsy report, from the patient, the age, their menstrual status, whether they smoked or not, and then depending on the therapy that is given to these patients, let's say there are 100 patients with exactly the same characteristics you may have if you have breast cancer. And out of the 100 patients, they say 10 to 15 years from now, What are your chances of being alive? And that is very important because when you consider surgery, this website will tell you at the end of 10 years, out of 100 patients that have exactly the same characteristics that you have in terms of pathological report, in terms of your age, your menstrual situation, menopausal or postmenopausal, the size of the tumor, whether it's spread to the axillary nodes or not, and the receptors for estrogen, receptors for progesterone, K167, HER2 receptors. And once you have all that picture, they say, okay, we have 100 females with exactly the conditions that you have. What are the chances that those 100 will benefit from a treatment? For example, if the Predict website says at 10 years, 75% of the patients are alive at 10 years because of surgery. That means that 75% 75 out of 100 patients that get that treatment are going to be alive due to that treatment. So that's excellent. That's 75%. Then when we include the other things, you might be surprised as to how little or large benefit each thing has. That's why we want to present exactly the numbers to you. So then you can make an informed decision, meaning that you are informed with the best information available in the planet, and then say, okay, if, for example, hormonal blockade will give me a chance of 2 out of 100, you might think twice about that because that means I'm treating 100 females to benefit 2. But some people will say, I don't care if it's 1 out of 100, I want the treatment. So it depends on the person and it depends on how you see things. The other thing is that in the National Health Service of Great Britain, when this first came out, this Predict website, it was highly criticized also. And later on, they said, okay, let's repeat the algorithm. Let's put more patients to see if the oncologists are right, if this is something that has no value or if it's something that has value. So let's see if this has value or it doesn't have any value. So what they did, they included tens of thousands more breast cancer patients, and they found that the model was even more predictive than they had originally thought. So now the oncologists and the patients are very happy with this. And let me give you an example here. This is the website. And the website is very patient friendly. So as you can see here, in this particular situation, you start putting information in those brackets. And the information is about you. And once we have that information, then we can make a decision as to what will be the best treatment. At the end of this information, we get the results depending on what we put in these brackets. Size of tumor, age, different ways that it was discovered, whether it was discovered by screening mammography, whether it was discovered in a physical exam or symptoms, which usually indicates when it's physical exam that you did or symptoms, usually the tumor is a little larger than if it was found on screening mammogram. So there are two very important things that come out of this website. Besides telling you what the future holds for you statistically speaking, this website will indicate to us with high degree of accuracy what are the chances that you're going to do well in the future and the percentages. And it also indicates the contribution, and it also indicates the contribution of each therapy to your cure. So that's very important. We have to have that information to have an informed decision. Now, if you compare these things with different situations, you find out that the earlier that you find the breast cancer, the better. So I recommend to everybody that they get either a screening mammogram or a screening sonogram or a thermography of the breast or all of the above, because early screening is crucial for the greatest success. That's number one. Number two, are there other things that will benefit you in terms of increasing the chances of your cure in the future that are not included in this website? And the answer is yes. One of the ones that has been proven with randomized studies, as well as retrospective studies, as well as the correlation of it with survival, is studies about exercise. The American Cancer Society last year, for the first time, included in their website that exercise in breast cancer can decrease the chances of the tumor coming back and make you survive longer. In other words, exercise may cure breast cancer. That is amazing news. And this can be up to 15 out of 100 patients that start doing the adequate type of exercise will get a chance of being cured from breast cancer just by exercise. And exercise has to be specifically recreational physical activity, not a physical activity where you're stressed out. No, it has to be recreational, meaning that you're just doing exercise and relaxing and enjoying yourself. So remember, it has to be an exercise that you used to like when you were a child. For example, skating, running, cycling, bicycling, running, being in the beach, hiking. So depending on the type of exercise that you used to do when you were a child, that is the type of exercise that is most effective and associated with an increasing cure. In addition, there have been studies by Roswell Park Memorial with thousands of patients of breast cancer that show the association of exercise with cancer cure. Other people have also shown in randomized studies that in colon cancer, again, with thousands of patients, in colon cancer, with thousands of patients, we have seen that exercise is associated with decreased chances of the tumor coming back and surviving more. That means cure. The point here is that there are many things that can contribute to your cure of breast cancer, and once you know what those things are, the fear diminishes or goes away because you're empowered to do the things you need to do for a cure. In addition, we will show you in subsequent chapters not only how exercise can or may cure breast cancer, but other cancers as well. But if exercise, which is strengthening the body, it's able to contribute to the cure of cancer, what are the things that are strengthening your body will increase the chances of you being cured? These things may not have been studied as much as exercise, such as nutrition, excellent nutrition, detoxification of the toxins that are causing the cancers. Besides exercise, reduction of stress. These things, they may not have been proven as clearly as exercise. And in my opinion, exercise is already a done deal in terms of convincing me that yes, exercise is a must in every cancer patient to contribute to their cure. However, what the message is that whatever will strengthen you has a great chance of increasing your cure rate. And because detoxification, nutrition, and reduction of stress not only has the potential to increase the cure rates, but is strengthening you and is helping you with other health benefits that we know of. Why not do it? It makes sense to do all these things to increase your chances of being cured. So remember, we will be talking about not just how to use this website. We're going to be talking about exercise. We're going to be talking about detoxification, nutrition, and reduction of stress. Reduction of stress, taking the time to do guided relaxations is very important. I have a guided relaxation in Spanish, English, and instrumental in all the musical platforms like Spotify, Pandora, etc. And I recommend you do it twice a day because we have researched this and it has been shown that this meditation or relaxation, guided relaxation, has the potential to decrease pain, high blood pressure, high blood sugar, depression, anxiety, stress, and insomnia. So these benefits definitely, they will have an impact in your health and possibly also in your cure for cancer and other illnesses. In addition, I recommend the use of lipids of high volatility and tissue penetration, better known as essential oils. Many randomized studies have shown that it reduces stress, it reduces anxiety, depression, insomnia, pain. It increases the well-being. It increases your feelings of joy, happiness, and peace. And it does it in a chemical way by inhaling. So these are tools that are very, very important. Detoxification is very, very crucial. In the President's Cancer Panel report of 2010, President Obama told the National Cancer Institute, the National Institutes of Health, and the Department of Health and Human Services, he said, please, would you please do some research and write me a report of what's causing cancer in the United States. The report is available to everyone in the United States. You can download it or you can get a hard copy. And the report says, Mr. President, we don't know exactly the contribution of pollution to cancer because it hasn't been studied enough. There are 80,000 chemical substances in the environment that are potentially carcinogenic, and they haven't been studied. But we estimate that at least 2/3 of cancers are due to pollution. And these days, many people and many scientists say that is 90%. They agreed in this report that genetics account for less than 5% of cancer. So that's something to keep in mind, because in theory, if this is the cause of cancer from a physical standpoint, and you remove these things from the body, then the tumor may decrease or go away. And this is what we've been seeing in our medical practice for the last 30 years, that when we remove the causes of illnesses, the illnesses get better and sometimes go away. So keep that in mind in terms of toxins. The President's Cancer Panel report that say, the main causes of cancer we believe are pollution of the air, pollution of the water, pesticides, and x-rays in hospitals. The recommendations from the President's Cancer Panel report to reduce your chances of cancer included, number one was never come into your house with your shoes on, because you're bringing all those carcinogens that are in the floor in the outside world. You're bringing all those carcinogens that are in the outside world into your home and potentially increasing the chances of cancer and other illnesses in your family and or pets and yourself. The second recommendation, never drink water from a plastic bottle. That's how important they consider plastic at that time. That was 2010. We already know what's going on with plastic these days. And the third recommendation was, if you're going to eat food that has no hormones, no antibiotics, no pesticides. And that was very, very important, and it was stressed by the President's Cancer Panel report, which was written by the three authorities in the United States of Health and Cancer, National Cancer Institute, National Institutes of Health, and the Department of Health and Human Services. So I recommend that you take a look at this. We're going to help you navigate it. If you want some assistance, we will assist you with putting the information in and sending you a brief report of what this means. But anyone can do it, and this chapter will explain to you how to do it. So good luck with everything. Remember, don't be afraid. Chances are you're going to do well. Just remember to be informed and share this with your oncologists, your physicians, your family, and friends. I'm here to assist you, and I hope you do well in your journey.